Okay, welcome everyone. My name's Rob. I'll be teaching you clinical handover, effective communication skills in nursing practice. If a couple of housekeeping items, if they're in the event of a fire, leave all your personal belongings, follow me to the exit point, which will be out the door and to the left and out the door onto Westland Street. If you need to go to the toilet, out the same door, turn to the right, and the toilet's just on your right there. I'll get everyone to sign on, and I've got some PowerPoints for you. And just hand them across. Oh, yeah.
That's right. I don't think I'm festive anymore, it's just the leftovers. Yeah, it goes to my chest. Is that 1 inch? Yeah.
Yeah, 1 inch. Now, does anyone have any, does anyone know what clinical handover is?
Yeah.
Yes, everyone's, yep, comfortable comfortable with it?
Inside clinical handover,
Yes, yep,
SR,
yes, as
all
far
that
as.
stuff.
So clinical handover goes under the NSQHS Standard 6 communicating for safety standard. Effective communication is critical at all points where information is transferred. The standard focuses on ensuring self-care by supporting the principles of coordination and continuity of care. Errors with communication and clinical handover contribute to 70% of events that lead to adverse reactions to patients. And ineffective or the absence of clinical handover has serious consequences for the health consumer safety. Standardising the process of clinical handover is seen as key in improving individual safety. The ISBAR framework is the most often used as part of the verbal reporting process. It is a standardised approach to communication that can be used in any situation. ISBAR is an acronym that we use in nursing. It stands for Introduction, Situation, Background, Assessment, and Recommendations. The handover process should follow the organisational policies and use a standard process such as ISBAR or SBAR or ISOBAR. Part of this process should be a clear transfer of responsibility as it relates to the accountability of care for the individual and the transfer of accountability from care from one nurse to another. Is everyone okay with that?
Yeah.
Yep. Any questions so far?
What is ISOBAR? Never heard of that one.
ISOBAR is used more in emergency.
Right, so what is it? Introduction, situation, what's the O?
I'll get to that.
Perfect.
So yeah, it's used more in
Yeah.
it's used more in like emergency departments or in med calls.
Yeah, okay.
The principles of handover is preparing for the handover, organising the relevant members to participate, Does anyone know who the relevant members would be in the situation of being Glenda Linda?
Where have they handed out organising the relevant members to participate? Would we include the patient as well?
Definitely
Because
include
they
the
need to
patient,
listen,
yeah, they need to listen and they can
Is this
often,
not like on the board?
yeah, well, anywhere really, you can, anywhere you can,
I do on the board, I always sat in front of the patient,
yeah.
and then they'd be like, oh, don't forget, I take this
Yeah.
and that.
And it's always a good thing because sometimes we do miss things
Yeah,
and
absolutely.
the patient will often catch
Yeah,
that.
totally.
Being aware of the clinical context and their needs and participating in effective handover resulting in the transfer of responsibility and accountability. So effectively what you're doing is you're transferring the care of that patient from yourself to the next staff member. Indications for verbal reporting. When the care is transferred to another healthcare provider, so the transfer of responsibility of care. So that's basically, as I said, when you go over, in handing over to, from say a morning shift to an afternoon shift or an afternoon shift to a night shift. This could also be a matter of transferring between wards in the hospital. When the nurse recognises and responds to changes in the health status of the individual, so that's escalating concern. So you're going to provide a clinical handover to your team leader or the doctor.
Yeah.
And we use ISBA as a framework for both of these.
Doctors love this, but
They do love ISBA.
yeah, you just got to do that on the phone, or else they get in.
Bedside handover involves the clinical nurse team and the individual. We use bedside handover because it personalises care. It's more accurate information exchange and comprehensive visualisation and identification of care priorities. So what kind of things do you think we could visualise with the patient
So what's that?
when you're handing over on the bedside?
How they look.
Yes.
They look well.
How they look? What else?
They're, like sweaty.
Yeah, you're kind of looking at stuff like, you know, do they have drains, IDCs, do they have IV
Oh, okay.
therapy
Is that
going?
more of a medical
Yeah.
situation?
Yeah.
No, if they have
This is just
drains,
handover,
IVs,
yeah.
anything like that. You would check if the drain's still in situ, if it's drained, anything, wounds. If there was a patient coming back from theatre, you would check the wound, check any drains. What's this one? It's beneficial for students and less experienced staff as well, because you can actually visualise, inexperienced staff can visualise the patient.
I always drum aspirants and students.
Yeah. So confidentiality concerns are managed through the organisation's policy, which will outline the information that can be conveyed in this forum. Those who may not participate include patients that are asleep, confused, comatose, in isolation, difficulty communicating in English, and experience other conditions that preclude participation or sensitive information. So sensitive information, if the patient has a bad, patient's gone for some tests and they've had a result come back that's not ideal, the doctor hasn't actually spoken to the patient yet, so in that case, we would not say that in front of the patient. So escalating concern about the health care status, we use the ISBA framework. So can anyone tell me what ISBA stands for?
Introduction,
Again?
situation.
Yeah,
Background,
Background,
assessments,
Yeah.
recommendations.
so, identification, what are we doing?
arm and check,
Yeah,
What was that, sorry?
arm and check.
Arm bench.
yeah, what else are we doing? If we're handing over clinically to someone,
Sorry, I'm still in like recovery mode.
What, like on the
So-
phone or on the bed?
phone, bedside, whichever, so
So-
what's the first thing you're gonna do?
Oh, identify the
Identification.
patient, Mr.
So you're gonna identify yourself?
Identify, so say, hey, it's time, you're
Yeah.
in recovery here.
Yeah,
It's
you're gonna,
ringing about
Yeah,
friend of
yeah,
thing.
friend of Gaffney.
yes, so you're going to identify yourself, you're gonna identify the patient,
Situation.
and, yeah. So situation, what are we identifying today?
Brendan
Gaffney.
slipped off onto the floor.
Brendan's had a
Let's
fall
go
to
to the
bed.
toilet.
Yeah.
Wasn't gonna be.
Had a fall.
Yeah.
Seems a bit confused.
Yeah. So we're identifying the actual situation of what has actually occurred
Yeah,
that we need to get
yeah.
over.
Yeah.
Okay, what are we saying with background?
Has a history of confusion, since his operation.
Yeah.
And he has osteoporosis.
So just like history.
Yeah.
and stuff, and he's.
So doing history, yeah.
Yeah, and maybe he had like a change of medication 3 days ago or.
Yeah, yeah. Anything that, any medical history or any relevant background history that the doctor or the other nurses might need to know. What about A?
Assessment. He seems to be sore on his left hip.
Yeah, so what kind of assessments would we
Yeah,
do?
they do, your OBS,
Yeah.
your ads.
Vital signs?
Did he hit his head?
To be
Yeah,
his
so
yes.
is
Going
it someone who had a
bleeding.
fall, you'd probably do neurologs?
Yeah.
Anything else we would do for assessments?
Just the, like,
Well, just, does he need an X-ray?
Yeah.
An X-ray?
So do pain assessment as well?
Yeah, pain assessment, yeah, he's,
Yeah.
he's in pains.
neurobes.
Yep.
Trying to
So what kind of, what about, R, which is recommendation, what's that?
Recommendations is, I think he needs an X-ray.
Yeah, it's your recommendation.
Yeah, I think you need to come in and look at him.
I think he might be septic, so let's do some like
Yeah.
blood cultures or something.
Yeah, it's
So
so,
he's had a UTI for days.
Yes.
so it's basically, it's your recommendations to the doctor or to the other,
That's right.
other nursing staff or your team leader.
Also, he was incontinent.
So ISBA, the ISBA framework, it can be used face-to-face, on the phone, over video conference or Zoom. The principles of handover remain the same regardless of the mode of communication. So ISBA doesn't change on the phone and it doesn't change on video conference or face-to-face. So we still follow that same identification, situation, background, assessment, recommendations. The nurse provides a summary of the individual situation, background information, nursing assessment, interventions, and the individual's response to those interventions, and any request or recommendations for the purpose of discussing the treatment plan and options with another healthcare provider.
What does isobar mean again? You were gonna tell me about that.
Isobar, okay,
Yeah.
let me just find where isobar thing. Did have one for that one, hang on, let me just.
Is there any chance we could also do like a practice handover, like, you know, I could.
Yeah, we can do that, we can do that. Hang on, let me just,
We could lay Brendan on the table.
Oh my god, yes, let's recreate this situation.
Can you lay on the floor, Kat?
Then fall, wet your pants. Don't you get,
Yeah, so isobar, I'm not familiar with that one.
yeah,
I actually always, you know, I'm never really done
Do you wanna
this.
try and
I feel
guess?
like this happened after
I'm an Esparchi, I'm an Esparchi.
I'm not,
all
I've
the way.
literally never heard of the one use
So as we discussed before, Isobar is used more in emergency
Yeah,
situations.
yeah.
So you're using it for met calls, you're using it for, in emergency departments or in ICU.
Yeah,
So in your case with recovery, if your patient was deteriorating in recovery, you
Yeah.
would use this one. So same situation, it's identify, so you're identifying yourself,
yeah,
you're identifying the patient, and then we go to situation, why
yeah,
you're talking to the doctor, what's going on with the patient. Now O is basically recent observations.
oh, okay,
Yeah.
right.
So that's the,
Oh,
yeah, so basically,
That would that be in your assessment?
Yeah,
That's okay.
yeah, it is in your assessments, but in your assessments, you're basically saying you've done the vital signs. You've done
Yes.
vital signs, you're not actually saying, like, in an emergency situation, the doctor would want to know, well, what are the vitals?
Yeah,
So you'd be saying, so observations, when you got to observations in the ISO bar, you would say, okay, these are the patient's observations. Blood pressure is,
So that's if there's been a sharp clinical change.
yeah, so like a deterioration or a
Yeah.
sharp clinical change, or, you know, the patient's, you know, as I said, we mainly use it for met calls and stuff like that, because when you're doing a met call, what's the first thing the doctor's gonna come in? The doctor's gonna know who the patient is, what's happened, and the next thing they're gonna know is what are their odds. So they're gonna wanna know what the BP is, what the BP is, what their heart rate is, what their SATs are, what their temperature is, what their neurological status is,
yeah,
all that sort of stuff.
yeah.
So, does that make sense?
Yeah, no,
Yeah.
totally. And with this, errors with communication and clinical handover are contributed to 70% of events that lead to adverse events in patients. I've actually seen, that's the Swiss cheese, isn't it? I've actually seen that happen
Yeah.
many times.
But how often have you gotten handover from another nurse and they've omitted something or, you know, forgotten?
Absolutely.
Yeah,
And then it's just that
Oh, or in
Swiss,
recovery,
Swiss
where
Yeah.
cheese effect.
hey, how was your weekend?
yeah,
He's fine.
yeah,
Not a surprise.
yeah, it's very,
Yes.
you know, you,
Yes.
sometimes you're gonna get very difficult,
And it's hard because in
Other stuff.
recovery, sometimes you just relieve someone for a meal break.
yeah,
You go over there and you're hanging out with the person, and I had this old boy recently, and he was just not quite right, and you just think, oh, righto. And then I was like, what the hell is going on here? And I hadn't been, we hadn't done the S-bar, I didn't know he was diabetic.
mhm.
And
That's
actually, the
one of
nurse
the
before
worst
me
things.
didn't know, the doctor didn't even tell he was diabetic.
Well, that's half the thing, I think,
His PSL was 1.9.
But see, that's why even if it's just something as simple as,
Yeah,
you know, you're covering someone for their break,
yeah,
you know, it doesn't have to be a really in-depth handover,
no,
but it should be,
he's the main
this is
thing.
what he's coming with, this is the patient,
Yeah,
this is what he's coming to have done, this is where we're at the moment, I've done these obs, you know, and like he's returning to the ward
yeah.
whenever.
That's right, because
Yeah.
otherwise you get that Swiss cheese, don't you, where the holes all meet up and there's a disaster, so.
Yeah.
I like that, Swiss cheese.
It's very, as I said, you use it and you don't actually realise how it sort of becomes second nature. You will just, when you're handing over to the patient,
Yeah,
you will use it.
but we
like-
still miss things like.
Yeah, and still
you know,
we still miss things, but as I said, in the aspect of like a bedside clinical handover, that's why it's always good to try and involve the patient. Obviously you can't, as we said, you can't if they're confused or anything like that. But even saying that patient being in isolation, you can still put them down on that and go in to check on that patient. Well, you still need to anyway, so you should still go in and
Yeah,
you know, involve that patient. And it gives the patient a sense of ownership about their care and their health. Like, you know, makes them feel like they've got a say in what's going on.
yeah,
Yeah.
yeah.
Any other questions?
So, can't make it go for ages having the patient involved, because yakky, they talk all the time on the
It can.
stuff, you don't need to.
They tend to listen though, don't they?
Yeah.
They'll be like, oh,
Yeah. Most patients
Which
will,
when?
most patients will listen.
Yep.
But they might, you know, as I said, it gives them the opportunity, and yes, some patients do want a bit of a chat, but it does give them, that time to actually speak to the healthcare team and say, you know, oh, by the way, this has happened, or, you know, like, or, oh, I got my medications today and one medication was missing. Like, we can follow that up. Like, is there a reason why that medication was missing? Did the doctor just not write it, or did the doctor cease it for a reason?
Yeah. Do the family like get involved? Is that something?
Yeah, it can happen.
Members get amongst it?
Yeah, family members can get involved, especially if it's like an elderly patient that might be a little bit confused or a little bit forgetful. If the family members are in there, they'll quite often jump in on anything that we've forgotten to hand over. And it could be something as simple as like we've given you background on the patient and we forget some medical condition that they've got, or it wasn't noted on him when the patient was admitted.
Do you still talk? Do you still go through it if it's written on the handover sheet, isn't it?
You still go through it, yeah. You still go through what's the stuff. Yeah. We still go through everything on the handover. So yeah.
Okay.
Okay. So now you guys are going to role play a ISBA handover.
awesome.
So what
So
we'll
I'll
do
hand over
is
to you, you're my
um,
nurse, Adam.
so who's going to be the nurse?
I'll be the nurse,
Yeah.
to nurse, or will he be the patient? Am I handing over to you?
You can hand over to me.
Perfect.
Yeah. So you're handing over to Adam.
Alright,
So Adam had a good day today, but later on in the afternoon, he got out of bed going to the toilet
yeah,
and he had a fall. He's in hospital for
yeah,
pneumonia,
yeah,
and he's on IV antibiotics.
brilliant, alright.
So when he fell, balls came around.
So, I'm handing over to you.
Yes.
So, hi Rob, I'm Tanya, and this is Adam. He's 78 years old. So basically he's actually just started mobilising. He's come in, he's gone to the toilet and he's had a fall. So introduction, situation, background is he's in for pneumonia. He's on IV antibiotics. He's normally pretty mobile. He doesn't normally have any wheelie walkers or anything